Basal insulin is fairly simple. However, bolus is something that we should explore more. Bolus insulin should be considered in two ways. One is to cover a meal, and one is to cover high blood sugar. These two things should be assessed separately. In advanced diabetes management, we calculate specific carbohydrate ratios to understand how much 1 unit of insulin will cover as far as carbohydrates in their meals. We also calculate specific insulin sensitivity factors. This is how much 1 unit of insulin will lower their blood sugar. So in endocrinology, we look at bolus insulin in two ways, to cover the meal and to cover a high. So how do we use an insulin sliding scale? Well, we discussed our fixed mealtime boluses calculated based on weight. Now, a sliding scale is to cover a high sugar. So if the patient checks their blood sugar before their meal, they should give additional sliding scale insulin in addition to the fixed bolus to bring their blood sugar back to normal after the meal. Most patients are shooting for a blood sugar of 150 or less. Thus, most sliding scales start at 150 and go up from there. If a patient is on a total daily dose of insulin of less than 40 units, they should be on a low dose sliding scale. If they are on 40 to 100 units of total daily insulin, they should be on a moderate dose sliding scale. If they are on more than 100 units of insulin per day, they should be on a high dose sliding scale. Remember, sliding scale insulin is in addition to mealtime coverage for bolus insulin. If a patient is particularly insulin sensitive or at high risk for hypoglycemia, such as an elderly patient, we may start a sliding scale at 200. We need to specify sliding scale to the specific patient. We also have a systematic approach to choosing our patient's insulin sliding scale. Insulin sliding scale should be used to cover hyperglycemia in addition to bolus insulin that's given for meals. If a patient's total daily dose of insulin is less than 40 units per day, we should choose a low-dose sliding scale. If their total daily dose of insulin is 40 to 100 units of insulin, we should choose a moderate dose sliding scale. If their total daily dose is greater than 100, we should choose a high-dose sliding scale. Each patient's sliding scale should be tailored for them individually, based on their insulin sensitivity and their specific individual targets.